How to perform a root canal treatment. Root canal treatment is a dental procedure used to treat severe tooth pain, decay, or trauma that has damaged the soft tissue inside the tooth known as the pulp. The pulp contains nerves and blood vessels. The goal of root canal treatment is to remove the damaged or infected tissue, clean the infection, and save the tooth. Here are the detailed steps of a root canal treatment. 1. Examination and diagnosis. Dental examination. 1. The dentist first carefully examines the tooth and the surrounding tissues. 1. This examination aims to assess the general condition of the tooth and the extent of the infection. 2. Your dentist evaluates symptoms such as pain, swelling, or sensitivity while examining your mouth and teeth. X-ray imaging. 1. Your dentist may take an X-ray to see the condition of the tooth roots and the surrounding bone. 1. The X-ray shows the extent of the infection and the shape of the root canals. 2. This imaging plays a crucial role in developing the treatment plan. 2. Local anesthesia. Application of anesthesia. 1. Local anesthesia is applied around the tooth to ensure you don't feel pain during the procedure. 1. The anesthesia numbs the nerves in the treatment area to block pain. 2. In some cases, it may take a few minutes for the tissues around the tooth to become fully numb. 3. Accessing the tooth and cleaning the pulp. Creating an opening in the tooth. 1. A small hole is made in the top part of the tooth. 1. This hole allows access to the pulp chamber inside the tooth. 2. Depending on the structure of the tooth and the treatment plan, this hole can vary in size. Removing the pulp tissue. 1. Once the pulp chamber is reached, the damaged or infected pulp tissue is removed using special tools. 2. This step is critical to prevent the spread of infection and relieve pain. 4. Cleaning and shaping the root canals. Cleaning the root canals. 1. After the pulp tissue is removed, the root canals are cleaned using special instruments and solutions. 2. This process ensures that all infected tissue and bacteria are completely removed. Shaping the canals. 1. The cleaned root canals are then widened and shaped using special instruments. 2. This step prepares the canals for proper filling. 5. Disinfection. Cleaning with antibacterial solutions. 1. The root canals are disinfected using antibacterial solutions. 2. These solutions kill any remaining bacteria, ensuring the infection is completely eradicated. 6. Filling the root canals. Filling with gutta-percha. 1. The cleaned and shaped root canals are usually filled with a rubber-like material called gutta-percha. 2. Gutta-percha hermetically seals the root canals, preventing future infections. 7. Temporary filling. Placement of temporary filling. 1. After completing the root canal treatment, a temporary filling is placed in the top part of the tooth. 2. This temporary filling protects the tooth until a permanent restoration is done. 8. Permanent restoration. Permanent filling or crown. 1. To restore the tooth's strength and function, a permanent filling or crown is placed. 2. A permanent filling restores the tooth's natural structure and appearance, while a crown completely covers the tooth for extra protection. Post-treatment care. Pain and sensitivity. 1. After a root canal treatment, you may experience some pain or sensitivity for a few days. 1. This is normal and usually subsides within a few days. 2. Your dentist may recommend pain relievers to ease the discomfort. Oral hygiene. 1. Keep your mouth and teeth clean by regularly brushing and flossing. 2. Your dentist may provide specific recommendations for oral hygiene. Follow-up appointments. 1. Schedule regular follow-up appointments with your dentist after a root canal treatment. 1. These checkups are important to monitor the treated tooth's condition and to intervene if necessary. Root canal treatment is an effective way to save your tooth and relieve pain. By paying attention to the treatment process and following your dentist's recommendations, you can maintain a healthy and pain-free tooth structure.